It was a crisp Tuesday morning when the studio lights came on for a popular health segment on a national television network. The guest that day was none other than Dr. Alan Peterson, one of America's most respected cardiologists, known for his ability to explain complex medical concepts in ways that everyday people could understand. On this particular episode, Dr. Peterson wasn't here to talk about cholesterol, the usual suspect in heart disease conversations. Instead, he wanted to draw attention to something that many people overlook until it becomes a serious threat: triglycerides. He began by sharing a simple but powerful truth. Triglycerides are not the villain by default. They're a natural part of your body's energy system, but when they get too high, they can quietly set the stage for heart attacks, strokes, and even life-threatening pancreatitis. This set the tone for a deep dive into what triglycerides are, why they matter, and most importantly, what you can do to keep them under control. What exactly are triglycerides? If you've ever stored leftovers in your fridge for later, you already understand the basic concept behind triglycerides. These molecules are your body's version of a food storage system, except instead of Tupperware, the storage is inside fat cells. Here's how it works. Every time you eat, your digestive system breaks down the food into usable parts: glucose from carbohydrates, amino acids from proteins, and fatty acids from fats. If you eat more calories than your body needs for immediate energy, the liver packages the excess calories into triglycerides. These triglycerides are stored in fat cells and can be released later when your body needs energy between meals, during exercise, or in times of fasting. From a survival standpoint, this storage mechanism is brilliant. It's what allowed humans to survive periods of scarcity thousands of years ago. But in modern America, where food is rarely scarce and high-calorie meals are readily available, the system can backfire. Why high levels are dangerous? Peterson leaned forward during the interview and explained the problem in terms anyone could understand. Think of your arteries as a network of flexible garden hoses that carry blood throughout your body. When triglycerides are too high, they mix with cholesterol and other substances, forming a kind of gunk that sticks to the inner walls of those hoses. Over time, that buildup, what we call plaque, makes the hoses stiffer and narrower, forcing your heart to work harder. This process, called atherosclerosis, is not just about clogged pipes. It can lead to heart disease, the #1 cause of death in the U.S. Narrowed arteries mean less blood flow to the heart muscle, increasing the risk of heart attacks, stroke. Plaque can break off and travel to the brain, causing a blockage. Peripheral artery disease, reduced circulation to the limbs, which can lead to pain, numbness, and in severe cases, tissue death. And then there's the lesser known but equally dangerous risk: acute pancreatitis. When triglycerides soar above extremely high levels, often 500 milligrams (DL) or more, they can inflame the pancreas, causing intense abdominal pain, nausea, vomiting, and potentially fatal complications. Dr. Peterson emphasized that this condition isn't rare among people who ignore persistently high triglyceride levels. Once your pancreas is inflamed, it's a medical emergency. People can and do die from this, he warned. Understanding the numbers, safe and unsafe levels in America. Triglyceride levels are measured in milligrams per deciliter mg, DL of blood. A simple fasting blood test can tell you where you stand. Dr. Peterson outlined the current medical guidelines: normal, below 150 milligrams DL, borderline high, 150 to 199 milligrams DL high, 200 to 499 milligrams DL very high, 500 milligrams DL and above, dangerously high with a significant risk for acute pancreatitis. These categories aren't just academic. They are based on decades of research linking triglyceride levels to cardiovascular outcomes. What's sobering is that many people in the borderline range don't take action until they slip into the high range and their doctor starts talking about medications. The sneaky problem: no obvious symptoms. And of the reasons high triglycerides are so dangerous is that they often cause no noticeable symptoms. You could feel perfectly fine while your blood vessels are slowly being damaged. Most people discover they have high triglycerides during a routine checkup, when their doctor orders a lipid panel, a blood test that measures total cholesterol, LDL bad cholesterol, HDL good cholesterol, and triglycerides. However, high triglycerides often come as part of a package deal with other health problems. High LDL cholesterol, low HDL cholesterol, high blood pressure, high blood sugar. When these occur together, doctors call it metabolic syndrome, which dramatically increases the risk of heart disease, stroke, and type 2 diabetes. The 6 main causes of high triglyceride. Peterson identified 6 primary culprits, many of which are lifestyle related and therefore within your control. Point 1. Too much sugar and refined carbohydrates. Sugar is the top offender. Whether it's in soda, candy, pastries, or white bread, your liver can only use so much glucose at once. The rest, it gets converted into triglycerides for storage. Refined starches like white rice and pasta act almost the same way in the body. They quickly break down into sugar, flooding your system and prompting the liver to ramp up triglyceride production. 2. Unhealthy fats. Not all fats are created equal. While healthy fats, like those in avocados and olive oil, can actually improve your lipid profile, saturated fats found in red meat, butter, and cheese, and trans fats found in fried foods, margarine, and many baked goods push your liver to churn out more triglycerides. 3. Excessive alcohol consumption. Alcohol doesn't just affect your liver's ability to process toxins. It also changes the way your body handles fat. Even moderate drinking can increase triglyceride production, and heavy drinking can cause a sharp spike. 4. Lack of physical activity. If you're consuming more energy than you burn, your body has no choice but to store the excess as triglycerides. Sedentary lifestyles, common in many desk jobs, make the problem worse. 5. Obesity and being overweight, especially when excess fat accumulates around the waistline. The liver becomes more active in producing triglycerides. In medical terms, abdominal obesity is a red flag for metabolic dysfunction. 6. Genetics and medical conditions. Some people inherit a genetic predisposition to high triglycerides, a condition known as familial hypertriglyceridemia. Others develop high levels due to underlying health issues like uncontrolled diabetes, kidney disease, or thyroid disorders. The natural nemesis, resistant starch. Here's where the conversation took an interesting turn. Dr. Peterson introduced what he called the natural nemesis of triglycerides, resistant starch. What is resistant starch? Resistant starch is a type of carbohydrate that doesn't get digested in the small intestine. Instead, it travels to the large intestine, where it serves as food for beneficial gut bacteria. How it helps stable blood sugar. Resistant starch causes a slower, smaller rise in blood sugar and insulin levels. This means less sugar gets converted into triglycerides. Gut health. In the large intestine, resistant starch is fermented by bacteria into short-chain fatty acids, which help improve insulin sensitivity. Liver signal. These fatty acids also signal the liver to reduce triglyceride production. Food sources: brown rice, oats, sweet potatoes, corn, beans, and lentils. Slightly underripe bananas. Pro tip from Dr. Peterson: cooking rice or potatoes and then letting them cool increases their resistant starch content. A simple trick to make everyday meals healthier. The lifestyle plan to lower triglyceride. Peterson concluded the segment with a clear, actionable plan. Increase resistant starch intake. Replace refined carbs with foods rich in resistant starch at least once daily. Examples: unsweetened oatmeal for breakfast, brown rice instead of white, beans in soups and salads. Eat omega-3 rich foods, fatty fish like salmon, mackerel, and sardines 2 to 3 times a week can reduce liver triglyceride production. Load up on vegetables. Think of vegetables as a sponge for excess sugar and fat. Aim for a colorful plate at each meal. Enjoy nuts in moderation. A small handful of almonds or walnuts daily provides healthy fats without overloading calories. Limit sugar and alcohol. Skip sugary drinks, desserts, and limit alcohol to occasional use or eliminate it entirely if your triglycerides are high. Exercise regularly. At least 30 minutes of moderate activity, brisk walking, cycling, swimming, 5 days a week. Maintain a healthy waist size, under 35 inches for men and under 30 inches for women, to reduce strain on the heart. And for those with dangerously high triglyceride levels. Dr. Peterson stressed that lifestyle changes often need to be paired with doctor-prescribed medication for best results.